welcome back to Co Founder Diaries. I'm Laquanda.
And I'm Tier.
And we're your
entrepreneur besties.
All right, besties. Today we have a returning bestie to our podcast. We have Ruth.
And she is actually going to be talking about her new endeavor today. So, I'm going to get the inside scoop, the inside tea, y'all. So, let's just get into it. Cookie, introduce yourself again for those who may be seeing this for the first time, didn't watch the other ones, maybe know who you are.
Hi guys, hi besties. My name is Ruth Scott. A lot of people call me Cookie. I am your multi-passionate bestie. I do so much, but today we're talking primarily about healthcare. I am an insurance broker and I assist people, navigate that medical and health insurance marketplace.
Yeah, so today we're wanting to dive into like what actually brought her to starting this endeavor because she's so multifaceted. The last time we was talking about her shapewear endeavor and her being a content creator, and now we're diving into the insurance world. Like she's just bringing y'all all the tea, okay? So now we want to talk about like what made you get into insurance and pretty much tell us your story in that.
Okay, so I got into insurance because I was doing something else. Like I said, I'm always doing extra stuff, and I had the opportunity to actually come to me when I had my shapewear shop, and I was basically helping find customers for the Affordable Care Act insurance. And at that time, I was not an agent, and I got actually asked to become an agent through this program that we were helping people get affordable healthcare. I feel like I always knew that I wanted to do something to help people. Like I'm always trying to do something to help people. I feel as though a lot of things that I do is navigated towards helping, like with beauty and stuff. I always wanted to do it because it helps you feel your best.
Yeah.
Shapewear, same thing. So when I got introduced to insurance, I was like, I feel like I can definitely do this because it's something that sort of kind of goes hand in hand with all the other things I like doing. So that's primarily how I got handed insurance. Basically, they pay for me to get my insurance. I'm like, I love a certificate. I'm a girl that if you're gonna tell me I'm gonna get certified in something, I'm gonna go ahead and do it. I just went ahead and did it, and for a minute I didn't do anything with it because I didn't like the company that actually assisted me on getting insurance, but it came right back full circle. So
I definitely live by that motto, right? So you put your passion, but you focus on your passion, but now you got your certificate in the back end and you realize, let me do something that is actually a necessity. Nowadays, when I think about, I want most stream income.
Period.
So nowadays, when I think about, okay, what new business I want to enter, it has to be a necessity, and that falls under that. So
it's definitely a necessity, especially with everything that's happening right now.
Everybody needs it. So even though the field may be saturated, it's okay because we all need health insurance. So, and as an entrepreneur, a creator, a founder, a lot of times we don't have it because we're paying a lot of things out of pocket. We 100%. Don't have an employer. So let's talk about a different type of insurance.
Yeah. So as far as what I specialize in,
I specialize in Medicare, which is for people who are 65 and older or on Social Security disability or have some type of disability. And then I also do Affordable Care Act. So that would be people who do not have an employer. But there are so many different avenues when it comes to insurance. I know later down our conversation we'll get to that, but there's, we have group insurance for people who actually run businesses. We have life insurance still. There's not just health insurance. There's so many avenues when it comes to insurance. Private insurance. You have, point of service insurance. Yeah. So it's so
it's a
many
big,
different
broad spectrum.
Yes, there's so many different avenues when you talk about insurance, and sort of kind of getting that. So you still have Medicaid. People don't understand, Medicaid, that's still insurance as well, even though it's governed by the state individually. But those are some of the more popular type of insurances.
Hey there, friends.
If you or someone you love is on Medicare and you know how confusing it can get, plans change, benefits shift, and it's tough to know if you're really getting the best coverage. That's where I come in. I'm Ruth Scott, a licensed Medicare specialist with Senior Benefits Group. I help you compare plans, understand your benefits, and make sure your coverage truly fits your needs at no cost to you. So whether it's time for your annual review or you just have questions, let's talk. You can email me at rscott.seniorbenefits@outlook.com or visit our website at www.sbenefitsgroup.com to schedule your free Medicare review. Let's make sure your Medicare works for you because a peace of mind shouldn't be confusing. Now, back to you, besties.
And being that we on our platform feel like we want to like share as far as putting our entrepreneurs on, I feel like this is a good topic to have because like you kind of said like as entrepreneurs, like we're trying to pay for all these things and we might even not necessarily be making actual money. So then that's where you could be talking to Cookie and she can help you with the affordable healthcare. Even people who are employed, you could qualify for affordable healthcare because even though you're making a certain amount of money, there's a certain huge portion that your job is taking out of your check bi-weekly. And if you kind of compare that to what maybe she could, what she could get you on the market, you actually might come out better actually going through that. Because I know like one of my family members is a government employee. He's like, no, I'm going through affordable healthcare because even though supposedly quote unquote the government gives them insurance, they don't get maybe it might not be the best per dollar. So you always want to shop around and figure out what's you know where you can get the best bang for your dollar, essentially.
Of course. And a lot of people don't understand that the Affordable Care Act has subsidies that suffice, a lot of the payments.
And that's
so
it.
your job doesn't. Yeah. So there's not really like a name for it. It's really just called subsidies. Yeah. They really help lower your out-of-pocket costs. So say for instance you're at a job and you're paying out of your check every 2 weeks $200 for your healthcare. At the end of the month you pay $400. Say when you go to use that healthcare, when you go you have to pay a co-payment. If you get prescription medication, you have to pay a co-payment. Deductibles, you have to meet your deductible before they even pay for anything when you go to the hospital. And I really wish that people will understand that you can, like you said, shop around. And that's why I say with ACA, there's like deadline, like not deadline, it's called like a bottom line, I want to say, that they can charge you.
Based on your income.
Based on your income. Yes. So a lot of those co-payments and deductibles and things like that are way lower than what you'll get when you get something out of your job. Because most people have group insurance that when they go to work. That's group insurance.
And it's way higher.
And it's way higher. Like it's depending on which one you want, it's a lot higher. So, that's why you should always have an agent that you talk to because there's a lot of things that are updated every year. Mm-hmm. And right now we're in open enrollment and it's best to go ahead, even if you are in something, speak to someone so that you can understand. Like a lot of people don't know what deductibles are. Exactly. Deductible means that's something you have to meet before the insurance will pay anything for you. Oh my God. And it's like, okay, yeah, you might have a free plan. You don't pay anything monthly, but if you go to use that plan, you will be paying. So that's some of the things that I try to make sure that my clients know, what they're going to get up front. And also listen to exactly what their needs are because, you're healthy, you're like, I don't need insurance. A lot of people don't remember as well that if you don't carry health insurance, you will be taxed or penalized. And they don't understand that because they haven't been penalized yet. But with all the upcoming changes and things, you do want to make sure that you just have something. Like I said, you could be healthy today and tomorrow you could not be healthy.
Things change rapidly.
So it's best just to, always make sure you're checking up on that every year when you have open enrollment. And that's what I'm here for.
Okay, I want to talk about the open enrollment.
Yeah, so open enrollment for ACA is going to be November 1st through January 15th. And then Medicare is going to be October 15th through December 7th. That's open enrollment, meaning that you can switch out of your plan and it will start January 1st. So you can switch out of your plan without making any penalties or anything happening for you. So it's best, like I said, to go ahead and check in on those times.
But talk about special enrollment because a lot of people also don't know this, that people have special enrollment periods, which I'm in the care industry as well. So you have special enrollment periods depending on what's happening in your life. Maybe you're a newer mom and you're about to give birth to a baby and you have an insurance plan. You're not stuck in that plan. Now that you're eligible, now that you're about to have a baby, you're not eligible to have a special enrollment period where you can actually shop around and figure out what's going to be best for your pregnancy.
Yes.
Because people don't talk about the cost that it takes to actually have a
baby.
bring your baby into this world. It's expensive.
Yes.
So take advantage of those. Like, talk about those different special enrollment periods.
Yeah. So like
you said, see, there are many special enrollment periods as far as giving birth, moving, getting put off of Medicaid. We know that, around 10 million Americans will be cut off from Medicaid going into the new year. Yeah. And that opens up a special enrollment period for you to go ahead and shop around. And as well, there's so many. I can go a list on and on.
Healthcare changes.
Yeah, changes in your eligibility status. And also, I wanted to put out the point where how you said about the giving birth, like those bills are very high, and in a lot of, I don't want to say private insurance, but a lot of group insurance plans is not, like, pregnancy is not covered and giving birth is not covered, and a lot of people don't know that or understand that. So that is a really good one. As far as,
or there's limited coverage. You got to look into those fine lines. It may be like 20%, 30%. And you're like, wait a minute, why is my bill this high? I have insurance. And that's the thing that people don't know. Like, really look into your policy, because they break it down. Like she said, you got deductible, you got co-insurance. People are like, what the hell is a co-insurance?
Co-insurance is just like you said, like the percentage. And like some people have co-payments, which will be like, okay, you have to pay $25 to go to the doctor. Mm-hmm. You may have co-insurance, which means you have to pay 30% of the bill to go to the doctor. Mm. So like you said, it's
and
really
then on top of that, you still have a deductible.
You still have a deductible to meet. So if you're not getting a preventative service that is covered, you're going to be looking at a bill come to your house 2-3 weeks. And you're like, what's going on? And we know they tack that stuff on your credit. So, being an entrepreneur, those are things that you don't want to be attached to yourself. Mm-hmm. And like you said, a lot of entrepreneurs, we don't have a boss that's giving us insurance or benefits, right? And there are supplemental benefits, there that you can shop around as an entrepreneur. I'm really looking to get into that, providing
that could be a space for it.
Yeah, providing for, entrepreneurs, because what happens when you get sick? Mm-hmm. Nobody, you feel like I can't take a day off because nobody's going to pay me. Mm-hmm. There's supplemental insurance for that. Mm-hmm. So we're going to be adding that to our family, our umbrella of services that we're providing shortly. And
I would love to hear more about it once you
that's something that that we can have you back, because that's a big educational piece that people don't talk about. And like just talking about having all these out-of-pocket expenses when you aren't making money. Mm-hmm.
It's scary.
Because you aren't making money in the beginning of entrepreneurship. It's more so like, you funding out-of-pocket into your dream blossoms at that point.
Yes.
So.
And I'm pretty sure a lot of people, they put it in the back end because on your mind, health is important, but also I understand that you're probably balancing so much that you probably think it's like so expensive that you can't afford it. But I sit here and listen to Cookie, and it's affordable.
Very affordable.
Honestly, I didn't even know that because I still have an employer, so I have health insurance, but I didn't know it was an option to even tailor a plan for me.
Yes.
And even while being employed, like Cookie was saying, like even though I'm employed and my company offer me insurance, I still have the right to say, let me shop around. So every time special enrollment period, your job lets you know it's special enrollment period. You don't have to enroll right away. You can wait to the end, shop around, see who has the best rate, and then go with that, so that you can pretty much save yourself a lot of money. Because at the end of the day, these jobs, you're paying between $400 and $600 if you have a family, $400 to $600 every 2 weeks. And then only to then go into the doctor, like she said, every time $150, $200, $500 because you didn't meet your deductible or co-insurance. Like, what?
Yes.
On top of me, I'm every 2 weeks paying $400 to $600.
It's crazy.
Who have money like that?
I'm trying to tell you.
You kind of feel like you throwing your money away, essentially, because I'm starting to feel like that now. And I've been in the insurance industry for almost 14 years, y'all. And my benefits is just not It's not hitting.
Yeah, it's not hitting your knee. And then, like I say, as you get older too, like you start to realize different things change. Like you're not younger anymore. You need to get checkups.
More
Like,
checkups.
Us as women, like really, even men, like I don't even like to be like gender, like, you know, to the side, but I'm a woman, so I'm just gonna always speak up for women.
Yeah.
Like we need to be going to get checkups. And sometimes it's so sad because I see girls all the time, like, I can't afford to go to the doctor. I don't, what? There are free
and they
clinics.
do the bare minimum as it requires. Like me and Cookie was talking about, like all these different exams that we should probably be doing like yearly. That as Black women, and we're gonna hone in on Black women because we are Black women. That we are susceptible, I guess,
Yes.
to more things than others, and we are completely neglecting those things, and we're just pushing it through because we're strong or because we can go get a pain pill. And it's like, no, go and get those things checked out, and you don't have to pay an arm and leg to do it. You just have to figure out a plan that's going to be tailored specifically to you, because we have that flexibility, and we just need to take advantage of all of the opportunities that we have that other countries don't have.
Exactly.
For real.
I also want to speak a little bit about that too. Like, it's not even the fact that you necessarily have to get into a plan. Like, okay, I understand it could be overwhelming talking about that, but they do have free clinics that, especially if you're not a low income person, say for instance, you can't get Medicaid, but you're still low income. They have clinics where you can go and you can pay $20 or $25 or $50 to go and see a doctor. And, you know, that's better than paying a monthly $200 if you want to be technical about the situation. Seriously. And that's why I still even preach that too to people. Like, even if I'm not helping you find a plan, if you just ask me like, hey, like, what should I do? Like, I need to go to the doctor and I really don't know what's the this and that. Listen, I can definitely help. Like, I want to help you. I want people to understand that you don't just have to ignore things. Like, you need to be going to get checked up. Like, lately, I even been dealing with my health and health scares.
Same.
And I'm like, luckily I know what I know, but there's many people who don't know, and it's just very sad.
It shines a light on, like, dang, this is even more why I could be of a service to people.
Yes, exactly. I feel like that's what made me feel more like I wanted to do this on my own, like actually putting this out as a business, because before I was working with a company and I learned a lot from it, and I got laid off in April, and I was just like, you know, maybe I should go, like, I have my license, I can go get another job, but then I'm like, how am I gonna help people if I'm just working from behind a phone and just calling all day? Yeah, I'm helping them, but what about my actual community and people that I actually know? I think that's what really drives me in this actual industry. Is like, you know, I really want to help somebody. I don't want to just be like, oh, you know, I did
another number.
Yeah, I did 250 sales this year. I did 500 sales this year. I'm at this and I'm at that. No, it's really to actually bring awareness to people that they need to stay on top of their health. And like I said, it's a lot of changes coming up as well that is trying to prevent us from being able to do this.
So you need to really be aware.
Right. That's what makes me be like, you know, it's something about this. If they're trying to take something away, it's something behind it that's really the motive of why they're trying to take it away. So that opens up my eyes a lot about this industry as well. But that's primarily.
So you kind of shedded a lot of light and a lot of things and a lot of angles we could go into, but like, and you kind of like alluded to something new that you want to expand on, but like, talk about that, like future plans, like what do you feel like you could do more within your business, or what are you going to be doing, what people can look out for, those type of things?
Yeah, so I definitely am going to be, like I said earlier, looking into like supplemental benefits, which are like disability, specialty insurances such as like cancer insurance. So if you're a type of person that has hereditary cancer in your family and things like that, that's like something that you can pay for, that just helps that financial burden, because we all know cancer and different things like it's at an all-time high, and it's expensive. Yes. Like, have you looked up Moffitt?
You just get completely in debt. So many families go into debt off of that.
Yes. So I really want to that is like number one on our list, to expand. And that also, you know, getting more agents to actually make the brand bigger. Okay. So not just myself, but actually having, you know, other agents in different states being able to, help out in their community as well. So that's definitely on the list is expansion as far as, creating
The community,
actual,
essentially.
yeah, community and actual people don't know, like sometimes they don't know what they want to do. So I feel like I also can help people who
Got them.
work from home or mothers. They're like, I don't know what I want to do. Like I want some type of business. I want something that's my own, and that's something that you can do from home. You can work from home being an insurance agent, and a lot of people don't know about that either. There are a
People
lot
been
of
doing it for
agents.
years, but now it's starting to come, I feel like, more to the forefront.
Yes.
Essentially.
When I go out to a lot of our agent like mixers and stuff, I swear they tell me all the time, like, you're the youngest person here.
Really?
Yes.
Young people aren't doing it.
Young people
It's
aren't
needed
doing
then.
it. It's very needed.
Because
And that's
a lot of people are about to start aging out of that career
yes.
field.
Quick break. If you're like most people, insurance can feel super confusing. Whether it's figuring out your Medicare options or finding the right Affordable Care Act plan, it's easy to get overwhelmed. That's where I come in. My name is Ruth Scott. I am a licensed Medicare specialist with the Senior Benefits Group. I can help you compare plans, understand your benefits, and make sure that you're not paying more than you need to, all at no cost to you. So if you or someone you know needs a Medicare review or Affordable Care Act coverage review, let's chat. You can reach me via email or on our website at www.sbenefitsgroup.com to get started today. Do not wait until deadlines sneak up. Let's make sure you're covered and confident with the healthcare choices today.
Has been so amazing. I cannot wait to see what Ruth's gonna do. Make sure you guys stay tuned. Follow her on all the social medias. Thank you for sponsoring our video, FSBG.
We really appreciate it, and we look forward to many more partnerships.
Yes, we do. All right, Tiara, is there anything you want to promote before we close out?
Make sure you're following GC Collective 813 on Facebook and Instagram. I have something brewing for the holidays, so make sure you tap in.
As for me, the holidays are here, so make sure you check out filmduo.com. We do have some new collections dropping. Also, Black Friday is coming up. And you can also follow us on social media, Instagram, Facebook, TikTok, shop.film_DeLonia.com. Bye, guys.